Okay, so in one of the days at work, my trainer asked me, why is povidone iodine not used on wound with graft or flap? So the reason is clear. One is that povidone iodine is cytotoxic. It's a broad spectrum antiseptic. It's toxic to living cells that are essential for graft take. So first of all, povidone iodine can interfere with wound healing because it can inhibit collagen formation. It can kill fibroblast cells, keratinocytes, even endothelial cells that are in the bed where your graft is, and this can interfere with the take and kill this graft. Then second is it can interfere with graft take. So how does it do this? It can interfere with take because it can the survival period for your graft is in the first few days, and this is when the plasmatic imbibition and the capillary inosculation occurs. So povidone iodine can interfere with this process in the bed, and this can inhibit the graft from taking, and also it can reduce the tension of the oxygen. Povidone iodine is believed to denature proteins. How does it do this? It can denature proteins within the capillaries, and when it does this, it decreases the blood flow to that bed, and when it does this, it can inhibit angiogenesis, oxygen delivery to the bed, and this can interfere with the graft or the flap and inhibits flap integration and graft adherence, and this can affect your wound. But alternate also, it can also cause local inflammation within that place. So povidone iodine can cause local inflammation at the wound bed. It can also cause pain. It can cause contact dermatitis, and all this can affect your graft take and then prevent your graft from being adherent to the bed. So because of this, povidone iodine is not preferred or is not used in a wound with graft or flap, but there are alternatives that can be used, such as one normal saline. You can use a 0.9% normal saline. It's gentle, it's non-cytotoxic, can be used in your graft. It can be used on your graft rather, and can help with it can be used on your graft actually. Then also we have nano silver, nano crystalline silver, which can also be used on infected wounds. We have diluted chlorhexidine. Diluted chlorhexidine can be used if you need antiseptic activities within that graft or flap. You can actually use it. It's less cytotoxic. It can actually be used. So I think this has actually helped you if you've been looking for the reason or trying to find out why povidone iodine is not used on wound with graft or flap. I hope you've learned a lot. Thank you very much.